Artiodactyla. That's the order.
Yeah, that's
the order. The class is Mammalia.
Do we have to know the orders too?
Well, it's a mammal. I mean, if I can ask you this class just as much as anything else. Like, is it in the Deuterostomia?
Yeah.
And it's Bilateria and Usilamata and all of those characteristics.
I know those.
Yes.
Okay.
And this is a mammal.
Yeah.
Okay. Let's go over some things here. First of all, circulatory. What I would feel justified asking here. This is anterior vena cava, right there. It branches, I'm doing the veins now, into internal jugular and external jugular. So, internal jugular and external jugular.
That's external?
Yeah, they're both right next to each other, internal, external. Then, if you watch, it will turn here, go into the right arm. So at that point, that's the subclavian vein.
How about the thin one right here, below or not?
This one?
No, upper.
This one here?
Let's just focus on the
Yeah, it's...
yeah, please.
Yeah. You don't want me to name that one, huh? Okay. Let's see. In terms of other things here, this would be the thymus here. That's all thymus on both sides. That's thyroid right there. That's the trachea. The bulb is the larynx. Underneath here is the esophagus. So I'm pulling the esophagus forward there. That's most of what I would ask in this region. Then going down to the heart, it's pretty obvious. This is the pulmonary trunk right there. This is the left atrium. That's the right atrium. This is the right ventricle. That's the left ventricle. And right here, keep it down. This is right there is the aortic arch with the brachiocephalic coming off of it there. And it goes up into the common carotids. You can see one here and one over there. And it also has a subdivision right here off of the arch. See, there's the brachiocephalic off of the arch. There's the left subclavian off of the arch going into the left arm. That takes us to the lungs. So lungs, this is the diaphragm here. Going down here we have the liver and this little structure in the right medial lobe, which is where I saw it before. It's the gallbladder. It's this tissue here, this floppy little tissue there is the gallbladder. It usually is. It's not always as they dry out. This is the umbilical vein. So liver, gallbladder, umbilical vein. That takes us to the stomach, which is here. The body of the stomach, pylorus of the stomach. That turns down here into the duodenum of the small intestine. And then this thing that looks like a bunch of beads in between, that's the pancreas there. The kind of thin material, small intestine, the thicker is colon. This is the descending colon here. Okay, descending colon here. This thing is the spleen. Then we have the kidney here. And we didn't see it on that side, but on the other side you can see the ureter. I know we had it a second ago. Here it is here, that kind of coil thing. That's the ureter right there. That goes down to the urinary bladder, which is here. Then if we were to follow the aorta down, oh, somebody did do this. This is the aorta here. This first blood vessel branching off of it is the celiac. That thing right there is the celiac. It goes to the spleen, to the stomach, and to the liver. This thing here is the superior mesenteric. So that's superior mesenteric there. I don't know how well you see that. So there are two together. I'll make sure you can see both of them. Celiac here, superior mesenteric. Then going down here is the renal artery and the renal vein. The inferior mesenteric I'm not going to do, but as you get down into this region here, you can see the aorta splits. And these are the common iliac arteries going down into the legs. That's about it. Excuse me.